The axial skeleton consists of 80 bones. We have 8 cranial bones, 14 facial bones, 6 ear ossicles, 1 hyoid bone, 26 bones in the vertebral column, and we have 25 bones making up the thoracic cage. Let's start by looking at the bones in our skull. And making up our skull, we have the bones that form our cranial cavity, and those are called cranial bones. And the cranial bones are the ones that will encase our brain. And we also have, making up the skull, bones that are in our face. And obviously, those were named facial bones. We have 8 cranial bones and 14 facial bones. And the 8 cranial bones are the easiest ones to remember because you just need to remember past of 211 to 11. We have 2 parietal bones, 1 ethmoid bone, 1 sphenoid bone, 2 temporal bones, 1 occipital bone, and 1 frontal bone. The total is 8 cranial bones. When we have 2 of the same bone, like we have 2 parietal bones, and we have the 2 temporal bones, we say those bones are paired. Like when you have a pair of shoes, you have the right and the left one. Here you have paired bones. You have the right and the left parietal bones, and you have the right and left temporal bones. When you only have one of that bone, that is called an unpaired bone. And this paired and unpaired nomenclature will serve for all bones in our body, as well as for blood vessels that we'll be covering later on in the semester. We will have paired blood vessels, which means that we'll have the right and left version of that blood vessel, and we will have unpaired blood vessels, which means that we do not have right and left, we only have one of them.